70% of India's poor live in rural areas where health centers are small scale and source energy from costly diesels with no reliable power backup. Disruptions in power supply not only affect basic administration but also medical procedures, immunization, and critical diagnostics. Most of these healthcare centers are not designed for comfort, causing heat stress in both the health workforce and patients seeking healthcare, increasing the time and cost of healing. Lack of access to reliable and affordable energy sources affect service delivery on a daily basis, more so during extreme climatic events when power disruptions are at peak. In sub-centers and primary health centers in remote locations, metal roofs and lack of cooling solutions increase indoor temperatures and thus heat discomfort. Lack of proper refrigeration lends to loss of vaccines. 70% of medical decisions are based on diagnostics, and early diagnostics are critical for handling the increasing disease burdens, but lack of reliable power disrupts this. The climate crisis increases the risks to human health and well-being. Heat strokes, risky pregnancies, premature mortality, vector-borne diseases are all projected to increase and overburden the existing energy infrastructure in healthcare facilities. With increasing climate-induced disease outburst and energy disruptions, the foreseen burden on ill-equipped healthcare facilities cannot be overlooked. If the global healthcare sector was a country, it would be the fifth largest emitter of GHG on the planet, equaling emissions from 514 power plants. India's health sector has the seventh largest climate footprint currently. Sustainable Energy-led Climate Action Program is optimizing energy solutions for the last mile health centers for climate resilience and mitigation in India. To make healthcare infrastructure and systems work for each other, SELCAP is retrofitting health centers with decentralized renewable energy systems, energy efficiency measures, and efficient built environment designs, while upgrading them with health partners for services that are needed as per increased disease burden. SELCAP is assessing the public health infrastructure and designing reliable energy solutions for varying medical care needs as per the demand in the region, be it maternal and child care, palliative care, NCD or non-communicable diseases, trauma care, etc. Switching to a greener energy alternative like solar reduces load on existing power systems during outages and disasters and expands the functional capacity of health facilities, also increasing efficiency in the long run. SELCAP is replacing inefficient electrical and medical devices that consume high energy and increase the costs, like lights, fans, refrigerators, and medical appliances in a labor room, laboratory, etc., with alternatives that are low power consuming and have appropriate features. This reduces the cost and increases overall efficiency of decentralized health systems at the centers. Under its built environment solutions for public health facilities, SELCAP is redesigning and customizing lighting, ventilation, and insulation infrastructure. This decreases use of lights during the day, decreases use of fans, coolers, air conditioners in times of heat stress, enhances thermal comfort overall, improving recovery capacity of patients and productivity of medical practitioners. SELCAP's DRE solutions are improving reliability, access, and cost efficiency to adapt to increasing healthcare needs due to climate risks for last-mile communities and healthcare workers. It is working with healthcare institutions, national and state governments, and implemented successful transitions of healthcare facilities in over 10 states. SELCAP solutions are region and situation sensitive and encourage local adaptation, upgrading India's healthcare facilities for climate action without further contributing to emissions.